Hello and welcome to the Emergency Room Podcast, the place where we delve into the fast-paced, life-saving world of emergency medicine. Are you ready to explore the critical decisions and cutting-edge treatments that happen daily in the ER?
Welcome back to the Deep Dive, where we go well deep. Today, we're going to be looking at something that affects millions of people around the world.
Yeah, a condition that can really impact your quality of life if it's not addressed.
Let's talk about COPD.
Chronic Obstructive Pulmonary Disease.
And we're doing this deep dive because, you guys sent in a ton of stuff on COPD, including the 2024 Gold D Pocket Guide.
Right.
And if you want to check out the source material yourself, you can find it at www.goldcopyd.org, Pocket Guide References. Now, before we get into the nitty-gritty, I just kind of want to paint a picture.
Okay.
Imagine struggling for each breath, like you're constantly gasping for air.
Yeah.
Even simple tasks leaving you just completely drained.
It's a scary thought.
That's the reality for many people with COPD.
It is.
But there's hope.
Yeah.
By understanding this condition, we can learn how to manage it, we can learn how to prevent it,
Absolutely.
and we can even advocate for changes that protect our lungs and our planet.
It's a journey from understanding it to figuring out how to fight it.
Okay, let's unpack this, starting with the basics.
Yeah.
What exactly is COPD?
So COPD is a chronic progressive lung disease that makes it difficult to breathe.
Okay.
And it's not just like a smoker's cough or anything.
Right.
It's a complex condition that involves permanent damage to the airways and those tiny air sacs in your lungs.
So irreversible damage.
Yes.
That's serious.
That's why our early diagnosis and management are so important.
Okay.
To understand it, though, we need to look at what causes it. There's this fascinating interplay between genetic predisposition and environmental factors.
So it's not just lifestyle choices.
No.
Our genes can play a role.
Absolutely. So there's a genetic condition called alpha-1 antitrypsin deficiency.
Okay.
And that can significantly increase your risk of developing COPD. But even without that genetic predisposition, environmental factors like smoking, being exposed to air pollution, certain jobs, all of those can damage your lungs and lead to COPD.
It's like a double whammy. Genes and environment, sometimes working together, sometimes working against us.
Right.
How would someone even know they have COPD? Are there like telltale signs?
One of the main signs is dyspnea.
Dyspnea.
Yeah, that's the medical term for shortness of breath. It's that feeling of not being able to get enough air, that struggle to breathe.
Okay.
And with COPD, it's often linked to physical activity.
Okay.
So you might find yourself getting winded really easily when you're walking up the stairs or doing things that never used to bother you.
That must be scary, feeling like you can't catch your breath.
It can be.
Is that the only symptom?
No, you can also have a chronic cough.
Okay.
And often that cough is accompanied by sputum production.
Sputum.
Yeah, it's that mucus that you cough up from your lungs.
Okay, so phlegm.
Right. And in COPD, it can range from a little bit to quite a lot, especially during exacerbations.
Exacerbations.
Yeah, those are the sudden flare-ups where symptoms get worse.
Oh.
And they can be pretty serious. Sometimes they even land people in the hospital.
So paying attention to these symptoms, shortness of breath, the chronic cough, producing sputum,
Right.
and especially if those suddenly get worse,
Yeah,
that's really important.
absolutely. Early recognition is key.
Okay.
If you have any of those symptoms, see a doctor.
Okay, so let's say someone is experiencing these symptoms, they go to the doctor, what happens next? How is COPD actually diagnosed?
The gold standard is a test called spirometry.
Spirometry, that's the one where you blow into a tube, right?
That's it. It
Okay.
measures how much air you can breathe in, how much you can breathe out, and how fast you can do it.
Okay.
And by looking at the results, we can see if there's any obstruction in the airways,
Okay.
which is a key characteristic of COPD.
So it's more than just checking lung capacity. It's looking for these specific patterns that suggest COPD.
Exactly. We look at a few key measurements, including something called the forced expiratory volume in 1 second,
Okay.
or FEV1,
Okay.
and also the forced vital capacity, or FVC.
Well, break those down for us. What do those terms mean?
So FEV1, it's the amount of air you can forcefully exhale in 1 second after you take a deep breath.
Okay.
So it gives us an idea of how quickly the air can move out of your lungs.
Got it.
FVC is the total amount of air you can exhale after taking a deep breath.
Okay.
So it reflects your overall lung capacity. And in COPD,
Yeah.
we see a decrease in both FEV1 and FVC.
Okay.
And that indicates there's airflow obstruction.
So lower FEV1 and FVC suggest COPD. Is there a specific cutoff point?
Yes, we look at the ratio of FEV1 to FVC.
Okay.
And if that ratio is less than 0.7 after using a bronchodilator,
Okay.
it confirms the diagnosis.
A bronchodilator.
Yeah, it's a medication that opens up the airways.
Okay.
We use it during the spirometry
Yeah.
to see if that airflow obstruction is reversible,
Okay.
which can help us differentiate COPD from other respiratory conditions like asthma.
So even with medication to open up the airways, if that ratio is still below 0.7, it's pointing towards COPD. Okay, so we've talked about symptoms and diagnosis.
Right.
Now let's delve deeper into what it actually feels like to live with COPD.
Okay.
We touched on dyspnea, that shortness of breath.
Mm-hmm.
I want to explore that a bit further.
Yeah.
It's more than just a physical sensation, right?
You're right. Dyspnea in COPD can have a really big impact on your life, both physically and emotionally.
Right.
Imagine feeling like you're constantly suffocating.
Yeah.
Like you can't get enough air no matter how hard you try.
Yeah, I mean, that just sounds terrifying.
It can be.
That feeling of air hunger.
And it's not just the physical feeling.
Right.
It's the limitations it places on your life.
Yeah.
Simple tasks like walking up the stairs or getting the mail can become these huge challenges.
Yeah, I can see that.
And that can lead to frustration, isolation, even depression.
So it's a vicious cycle.
It is.
The physical limitations lead to emotional distress.
Exactly.
Which can then make the symptoms even worse.
Right. That's why it's so important to address both the physical and emotional aspects of COPD. Right.
We need to manage the shortness of breath,
Yeah.
but also provide support and coping mechanisms to help people deal with the emotional side of this.
So it's about treating the whole person,
Yeah.
not just the disease.
Couldn't agree more.
Now, what about that chronic cough? How does that evolve with COPD, and how does that affect people's lives?
Well, it's often one of the first things people notice.
Uh-huh.
It can be really persistent sometimes, even keeping people up at night.
And it's not just the cough itself, right? You mentioned sputum production.
Right. Sputum or phlegm can have a big impact on someone's life, too.
It's interesting because when you think of a cough, you think of it as this temporary annoyance.
Yeah.
But with COPD, it's this constant presence.
Exactly. And the sputum itself can vary.
Okay.
Some people will have small amounts consistently. Others have more, especially during those exacerbations.
Yeah, those exacerbations keep coming up.
Yeah.
It seems like they're a pretty big part of this whole COPD journey. They're a major concern, and preventing those is a big part of managing COPD.
Okay, let's talk about that then. How do healthcare professionals approach COPD management? Is there a one-size-fits-all treatment plan?
No, not at all. COPD treatment is very individualized. We use what's called the GOLD ABE assessment to categorize patients and then guide our treatment decisions.
You mentioned that briefly in part one.
Yeah.
Can you break down how this GOLD ABE system works?
Sure. So the A, B, and E represent different aspects of the patient's condition. The A stands for symptoms.
Okay.
And we use questionnaires like the MMRC or the CAT to assess how bad those symptoms are.
So those questionnaires are looking at how much COPD is impacting someone's daily life.
Exactly.
Yeah.
The MMRC focuses on breathlessness.
Okay.
And the CAT takes a broader look.
Okay.
Cough, phlegm, sleep, energy levels, all that.
So A is painting a picture of, how much this is affecting your day-to-day life.
Right.
What about B?
B is all about airflow limitation.
Okay.
We measure that with spirometry. Remember those FEV1 and FVC values we talked about?
Yes, FEV1, the amount you can forcefully exhale in 1 second, and FVC, the total amount.
Right. Based on those measurements, patients are categorized into GOLD grades 1 through 4,
Okay,
from mild to very severe.
got it. So B is those objective measures of lung function.
Yeah.
Then we have E for exacerbations.
Right. We look at how frequent and how severe the exacerbations were in the past year.
Okay.
Were there hospitalizations? How often did they need steroids or antibiotics?
Okay.
And that helps us see who's at a higher risk.
Okay, so you combine those three things, the symptoms, the airflow limitation, the exacerbation history,
Right.
and you get this really comprehensive picture of an individual's COPD.
Exactly. And that allows us to tailor the treatment plans to their needs.
Now, you've mentioned medications like bronchodilators and corticosteroids.
Yeah.
Can we dive into those a bit more?
Sure.
What are bronchodilators and how do they work?
Bronchodilators are really the foundation of COPD treatment. They relax the muscle around your airways, allowing them to open up,
Okay.
which improves airflow.
So like easing a tight squeeze, giving the airways more space to breathe.
Exactly. There are two main types,
Okay.
short-acting and long-acting.
So short-acting for quick relief And then long-acting for more ongoing control.
That's it. Short-acting are used as needed for that quick relief of symptoms, like if you suddenly can't breathe. Think of those as your rescue inhalers. And then the long-acting ones are taken regularly to prevent those symptoms and exacerbations.
Okay.
They're like your maintenance crew.
Okay, and what about corticosteroids? When do those come in?
So inhaled corticosteroids, or ICS, are anti-inflammatory medications. They help reduce that airway inflammation.
Okay.
We often add those to the long-acting bronchodilators, especially for patients who have a lot of exacerbations or high eosinophil counts.
Eosinophils, those are the white blood cells involved in inflammation, right?
Yes, and those levels can help predict how well a patient is going to respond to the ICS. It's another piece of the puzzle for personalizing treatment.
It's amazing how you're piecing all these things together to create this targeted treatment plan.
Yeah.
Aside from medication, though, what other options are there?
Non-pharmacological approaches are really important.
Okay.
One of the big ones is pulmonary rehabilitation.
What exactly is that? Is that like a gym for your lungs?
You could say that.
Okay.
It's a structured program that combines exercise training, education, and support to help people with COPD breathe better and improve their quality of life.
So it's more than just strengthening the lungs. It's about giving patients the tools to manage their condition.
Exactly. Exercise is a big part of it.
Okay.
Helping patients gradually increase their endurance through things like walking, cycling, or even strength training.
I can see how that would be beneficial, building up those respiratory muscles.
Yeah.
But you also mentioned education and support.
Right.
So patients learn about COPD,
Mm-hmm.
how to manage their symptoms, conserve energy, use their inhalers correctly.
And the support groups provide a sense of community and shared experience.
Yeah, that emotional support is probably invaluable when you're dealing with a chronic illness.
It is. And there are things people can do at home that follow the same principles.
Like what can you do on your own if you can't access a formal program?
Staying active is key.
Okay.
Even simple things like walking, gardening, housework can all improve your breathing and your overall health.
Okay.
It's important to start slowly and gradually increase your activity levels.
So listen to your body.
Right. And then there are breathing exercises.
Okay.
Techniques like pursed lip breathing and diaphragmatic breathing.
Okay.
Those can really help you control your shortness of breath and improve your lung function.
Can you walk us through those? I'm picturing like yoga, deep breaths, Zen vibes.
Well, yoga's great.
Yeah.
But these breathing techniques are simpler.
Right.
Pursed lip breathing involves inhaling slowly through your nose
Okay.
and then exhaling slowly through pursed lips like you're blowing out a candle.
So creating that resistance on the exhale, slowing down the breath.
Exactly. It helps keep your airways open longer, which allows more air to flow out.
Okay.
Diaphragmatic breathing is about using your diaphragm, that big muscle below the lungs, to breathe more efficiently.
So engaging the right muscles to optimize that breathing.
Yes, and it can be as simple as putting one hand on your chest and the other on your belly and then focusing on expanding your belly as you breathe in.
Okay.
Easy to incorporate those into daily life.
Yeah, they sound pretty easy.
And they can make a real difference. Now, we've talked a lot about the physical aspects of COPD.
Yeah.
I think it's important to talk about the psychological impact, too.
Yeah, you mentioned earlier how dyspnea can cause anxiety. What other emotional challenges come with living with COPD?
It can really take a toll on your mental health.
Right.
The constant shortness of breath, limitations on what you can do, the fear of those exacerbations, all of those can contribute to anxiety and depression.
I mean, it makes sense.
Yeah.
When you're struggling to breathe and feeling limited, it's hard to stay positive.
Absolutely. And fatigue is another common symptom,
Right.
which can make those feelings of low mood and hopelessness even worse.
So it's really important to address that emotional and psychological side of it,
It is.
not just the physical symptoms. What can be done to help patients in this area?
First and foremost, we need to create a safe space for patients to share their feelings.
Okay.
Open communication is key.
Right. Let them know it's okay to talk about their struggle.
Exactly. And connecting them with support groups or mental health professionals can be really beneficial. Cognitive behavioral therapy, or CBT, has shown a lot of promise in helping people manage anxiety and depression.
So it's about giving them those coping mechanisms and strategies.
Exactly. Lifestyle changes can play a role, too.
Oh, yeah?
Getting enough sleep, eating a healthy diet, engaging in activities they enjoy, all those can boost mood and improve well-being.
It's a good reminder that mental health is just as important as physical health. Now, switching gears a bit.
Okay.
I'm curious about the role of nutrition in COPD management.
Nutrition plays a surprisingly big role.
Okay.
Malnutrition is pretty common in COPD patients.
Really?
And it can make symptoms worse,
Wow.
increase the risk of those exacerbations, and even impact survival.
Wow. I did not know that there was a link between nutrition and COPD.
Yeah.
Why is malnutrition so common, though?
There are a few reasons.
Okay.
Shortness of breath can make it tough to eat large meals.
Okay.
And fatigue can zap the energy needed to cook healthy food.
Right. So it's a combination of physical and logistical challenges.
Exactly. And some COPD medications can have side effects that affect the gut,
Okay.
which complicates things further.
So how do you address malnutrition in these patients?
We start by identifying those who are at risk,
Okay.
using screening tools to assess their nutritional status. Early intervention is key.
So being proactive, not waiting until someone is visibly malnourished.
Exactly. And once we've identified someone at risk, we work with them to create a personalized nutrition plan.
And what would that look like?
It varies based on individual needs.
Okay.
But some general recommendations include eating smaller, more frequent meals,
Okay.
choosing nutrient-rich foods, and staying hydrated.
So maximizing the nutrient intake, even if you can't handle those bigger meals.
Right. Are there any specific nutrients that are especially important for COPD patients?
Yes. Protein is really important to maintain that muscle mass.
Yeah, because that's often depleted in COPD.
Okay.
Vitamin D can support bone health,
Okay.
which is important because COPD patients are at increased risk of osteoporosis.
Right.
And calcium is essential for strong bones as well.
So you're addressing those specific vulnerabilities that are associated with COPD.
Exactly.
Now, before we wrap up part 2, I do want to talk about the elephant in the room.
Yeah.
COVID-19 and its impact on COPD patients. We know they're at higher risk of complications.
They are.
Why is that?
So COPD involves that chronic inflammation and damage to the airways, which makes them more vulnerable to infections like COVID-19.
So a COVID infection could be particularly dangerous for someone with COPD.
Yes, unfortunately.
Okay.
And if they have other chronic conditions,
Right.
which is common in COPD patients, that further increases the risk.
What advice do you have for COPD patients in this ongoing pandemic?
The COVID-19 vaccines and boosters are essential.
Okay.
They significantly reduce the risk of severe illness, even in people with COPD.
So vaccination is the first line of defense.
It is.
What else can people do to protect themselves?
Keep taking your COPD medications as prescribed. Don't stop without talking to your doctor.
Right.
Continue those precautions like masking indoors and social distancing.
So layering those protective measures.
Right, to
Yeah.
minimize your risk.
What about treatment if a COPD patient does get infected with COVID?
It depends how severe it is.
Okay.
For mild cases, rest, fluids, and over-the-counter medications might be enough.
Okay, but for more severe cases?
They might need antiviral medications, and some may even need to be hospitalized for oxygen therapy or other supportive care.
So you really want to monitor those symptoms closely and seek medical attention if they start to worsen.
Exactly. Early intervention can make a big difference.
On that note, we'll conclude part 2 of our deep dive into COPD. And we're back for the final part of our deep dive into COPD. We've covered a lot of ground.
We have.
From, the basics of what COPD is to the challenges of living with it,
Right.
the strategies for managing it.
Yeah.
Now, I'm curious about the future. What's on the horizon? What are we looking at in terms of research and innovation?
Well, there's a lot to be excited about.
Fair.
One area that's getting a lot of attention is precision medicine,
Okay.
using genetic and molecular information to personalize treatments.
Oh, wow. That sounds really interesting. Can you elaborate on that? How does precision medicine work with COPD?
It's about moving away from that one-size-fits-all model.
Okay.
We're learning more and more about the different subtypes of COPD and how they respond to different therapies. So, for example, we're identifying biomarkers like those eosinophil levels we talked about that can help predict which patients will benefit from inhaled corticosteroids.
So it's all about getting the right treatment to the right patient.
To the right patient at the right time.
At the right time.
Exactly.
Okay.
It's about getting the most benefit with the fewest side effects.
Makes sense.
Yeah.
And beyond that, is there research into new drug targets? Beyond the bronchodilators and the corticosteroids?
Absolutely. There's ongoing research into new drug targets looking at things beyond those traditional medications.
Like what? Give us a sneak peek into the future of COPD medications.
Okay, well, one area of intense research is biologics.
Biologics. That sounds like something out of a sci-fi movie.
They might sound futuristic, but some of them are already being used for COPD.
Okay.
We have monoclonal antibodies that target very specific inflammatory mediators, like IL-5 and IL-4, which are involved in that eosinophilic inflammation.
So these biologics are like these guided missiles, homing in on those inflammatory troublemakers.
That's a great way to put it. And the early results are promising.
Okay.
They're showing improvements in lung function.
Okay.
And fewer exacerbations.
Wow.
In certain COPD patients.
So it's about calming down that whole inflammatory cascade.
Yes.
Getting to the root of the problem.
Exactly.
Okay. What else is being looked at?
Well, researchers are also investigating new therapies that target other aspects of COPD.
Okay.
Like oxidative stress and mucus hypersecretion. It's a really dynamic field with a lot of potential.
It sounds like there's a lot of hope on the horizon.
There is.
For people with COPD. Now, what about advancements in those non-pharmacological approaches? Anything new there?
Yes, we're seeing a lot of progress in pulmonary rehabilitation, incorporating new technology and new techniques.
Like, are we talking virtual reality rehab? Exercising in like a simulated mountain landscape?
Not quite there yet.
Okay.
But we are using telehealth and remote monitoring
to
make rehab more accessible, more convenient.
So bringing the rehab to the patient rather than the other way around.
Exactly. Patients can participate in those exercise sessions and educational programs from home.
Wow, that's amazing.
Using video conferencing and wearable technology.
Especially for people who, have difficulty traveling or live in rural areas.
Exactly. It removes those barriers.
Yeah.
And beyond that, we're also figuring out how to personalize those exercise prescriptions. Using data from things like activity trackers to tailor those workouts to their specific needs and abilities.
So it's like having a virtual coach guiding your every move.
You could say that. And there's also growing interest in incorporating mindfulness and stress reduction techniques into those programs.
Mindfulness seems to be everywhere these days.
It does.
How does that fit into COPD management?
Well, think about it.
Yeah.
COPD often involves a lot of anxiety about breathing.
Right.
And mindfulness practices like meditation and breathing exercises can help manage that anxiety, improve their sleep, and just enhance their well-being.
So it's about calming the mind to help the body cope.
Exactly. And some researchers are even exploring non-invasive brain stimulation techniques.
Wow.
Like transcranial magnetic stimulation to modulate that brain activity and potentially improve their respiratory function.
Wow, that's really pushing the boundaries.
Yeah.
So we've got personalized medicine, high-tech rehab, even brain stimulation.
Yeah.
Sounds like the future of COPD management is really bright.
It's an exciting time to be in this field.
Yeah.
But with all this innovation, I think it's important to remember that one of the biggest things we can do is address the environmental factors that contribute to this.
Right, bringing it back to that air pollution.
Yeah. Smoking is a major risk factor for COPD, but air pollution is a big one too.
Yeah.
And it's a problem that's only getting worse.
What are the main sources of air pollution we should be concerned about?
It's a combination of outdoor and indoor sources. Outdoor, you've got things like traffic emissions, industrial pollutants, wildfires.
Right.
Indoor, you've got smoke from cooking and heating, chemicals from cleaning products, even mold and dust mites.
So it's not just what's happening outside.
Yeah.
It's what's going on inside our homes, too.
Exactly. And some populations are hit harder by this. People living in urban areas or near industrial sites. So it becomes an environmental justice issue.
What can we do about this? Is it about individual choices, or do we need bigger systemic changes?
It's both.
Okay.
On a personal level,
Yeah.
we can make choices to reduce our exposure.
Okay.
Things like taking public transportation, avoiding areas with a lot of traffic, using air purifiers at home.
Okay.
All those things can help. But like you said,
Yeah.
it's also systemic. We need stricter rules on industrial emissions, investments in renewable energy sources,
Right.
and policies that encourage sustainable transportation.
So it's about changing our priorities, recognizing that clean air isn't just a luxury, it's a necessity.
Absolutely.
Well said. It seems like we've come full circle from the individual impacts of COPD to these big societal factors
Yeah.
that play a role.
That's the beauty of a deep dive.
Yeah.
You start in one place and end up somewhere totally different.
Yeah.
but you gain a much better understanding along the way.
And that's what the deep dive is all about.
It is.
Thank you for joining us on this exploration of COPD.
It was my pleasure.
We hope you've learned something new,
Yes.
maybe gained a new perspective,
Absolutely.
and perhaps even a little bit of hope for the future.
There's a lot to be hopeful for.
Until next time, stay curious, stay informed, and stay well.